The diabetic foot. How does diabetes affect the feet? The diabetic foot, including diabetic neuropathy and peripheral vascular disease, can have serious outcomes. Estimates run as high as 26 million Americans suffer from diabetes, both diagnosed and undiagnosed. Appropriate foot care is one of the most overlooked aspects of the diabetic's daily regimen. The feet, along with the eyes, heart, and kidneys, all have the potential for serious consequences in a disease that many do not take seriously and choose to ignore until it is too late to reverse the devastation that the disease can create. As the disease relates to the foot, two major events occur as the disease progresses. Neuropathy. Many diabetics eventually lose sensation in their feet. This is known as diabetic neuropathy. Autonomic neuropathy, the simplest and earliest type neuropathy that is seen in diabetics, or patients unaware that they are diabetic, is seen in many cases as nothing more than dry skin, usually accompanied with athlete's foot. Sensory neuropathy, neuropathy which presents itself as relentless burning, tingling or numbness in the diabetic foot. There are various prescription medications on the market for the diabetic foot with neuropathy, all with varying degrees of success. Right now, Lyrica is probably the most popularly prescribed medication for diabetic neuropathy. Motor neuropathy. In this situation, elevated blood sugars will affect the nerves that innervate the muscles of the foot and lower leg and will cause changes in the way the muscles function. This abnormal function may lead to a more rapid onset of hammertoes and bunions, as well as other arthritic changes in the feet. Peripheral vascular disease. The other diabetes-related factor to the feet is peripheral vascular disease. Over time, diabetes causes the arteries going into the feet to essentially become clogged, and in doing so reduces the blood flow into the feet. This creates various problems, the most common being the inability of the tissue of the feet to get adequate nutrition. The skin becomes dry, thin, scaly, we lose the fat on the bottom of the feet, the bones become demineralized. This then makes the foot more susceptible to infection and difficulty in walking. Consequences of the diabetic foot. Diabetic ulcer. Too much pressure from walking on that part of the foot, plus not enough circulation to the area along with elevated blood sugars caused this ulcer to form. Once they occur, they can be very difficult to close. It is not uncommon for diabetic foot ulcers to take years to close, and in some cases they never close. This condition should be considered a medical emergency and immediate medical care should be initiated. Infection. Because a diabetic foot ulcer is an opening in the skin, the diabetic foot is much more susceptible to infection, either infection in the soft tissue, or because of the close proximity to the underlying bone, an infection directly into the bone known as osteomyelitis. Gangrene and amputation. Of even more dire consequence is the fact that a diabetic foot ulcer in the presence of very poor circulation may lead to gangrene, death of the surrounding tissue, usually beginning in the toe area, and in these instances many patients go on to amputation. Protecting the diabetic foot. Control your blood sugars. Inspect your feet daily, both visually and by rubbing your hands along the bottom of their feet, feeling for anything that may not feel normal. Anything questionable should be brought to the attention of your foot specialist. Moisturize your feet. Washing the feet well with soap and water. Proper fitting shoes are very important. No bathroom surgery. Diabetics should never perform what we call bathroom surgery, such as trying to cut out an ingrown nail or shave a corn or callus. Read the complete article at www.fot-pain-explained.com/diabetic-foot.html